Two, one. Blog Talk Radio.
Okay, what's happening here? We ought to have some music going on here, and it ain't happening here. What's going on? Okay, we're on live, but I don't know what happened to my music. Let's see if we can do that. Yeah, there we go. Good morning, ladies and gentlemen. Welcome to another edition of the Free American Hour. I'm your host, Clay Douglas, and my guest today is Alan Phillips, and Alan is going to be talking to us about vaccines, what you can do about it, should you take it, and this is not, Alan's not a doctor, he's an attorney. Hello, Alan. How are you?
I'm doing great, Clay. How are you this morning?
Well, I'm pretty good. I'm pretty healthy, and I haven't had any vaccines in about 40 years, so I don't know how that happened. I don't know how you can exist without having all these vaccines. You know, never had a flu shot. Haven't had a flu.
You know, I hear this over and over again, Clay, especially in the last several months, and as a consequence, or with the so-called pandemic, there are hospitals around the country were implementing new policies requiring nurses and hospital staff to get seasonal flu and swine flu shots. So I'm getting calls from people around the country, and I hear over and over again stories like one in particular. This is just an example, like many others, where the nurse said she'd been working for 30 years and had never had a flu shot. And it's the ones who get the flu shots that are taking their sick leave, you know, all through the winter, getting sick and having to stay out. But, you know, she's never sick and never gets the shot. It really does seem to be counterproductive, and we've seen that in a pretty compelling way with some of the statistics with regard to the swine flu in particular. Let me get back into that. I don't want to jump too quickly ahead of you here, though.
Well, this whole swine flu pandemic, I don't know anybody that's sick. I mean, nobody's called me, said they got swine flu. Nobody I know got sick. So where's the pandemic? I mean, I never saw it. Did I miss something?
No, you didn't. I mean, it's anecdotal, of course, but my report is the same thing. I was in court once, and I heard somebody tell the judge when they were doing the roll call for the cases that she was told she had swine flu, and so everybody was careful to get her out of there as quickly as possible, but she looked okay to me, you know, and I don't think she died. But, you know, we had Cheryl Atkinson with CBS News did an investigation, and she found last October she was reporting on a period of time prior to that point in time, and found that the incidence of swine flu had been misreported by a factor of by about 90%. And it was really odd. It was only a few weeks after the official declaration by the World Health Organization of the pandemic level 6 that the World Health Organization stopped doing laboratory confirmation of cases, and the CDC shortly after that recommended that the states stop doing laboratory confirmation, which is just really counterintuitive. If you've got a pandemic, then you want to be tracking that very closely and precisely so that you can know exactly what's going on with it. So the appearance is that they stopped tracking in order to overstate it and get away with overstating it. So they had doctors around the country diagnosing it based only on general symptoms and risk factors. What Cheryl Atkinson found was that there were some states where 80–90% of the cases that were listed as swine flu turned out not to be any kind of flu, or in some instances regular seasonal flu or other kind of flu. So it was really quite bizarre. And despite that, she makes this official report. The CDC, by the way, wouldn't give her the information, even though she used the proper procedures, Freedom of Information Act, and all that. So she had to go directly to states to get the data, and so she did that. 2 days after she made that report is when Obama declared a national swine flu emergency, where he went public with that position, and I guess he and Cheryl didn't talk about
let me just interrupt you. Let me interrupt you for just a second, because you made a statement about them forcing the healthcare professionals to take these vaccines, and I have been telling people for the last 10 years that anytime a communist regime takes over a country, they go after 3 classes of people in order. They go after the farmers first because they don't want you being able to feed yourself. And of course, plank number 9 on the Communist Manifesto is corporate farms. Can you say Monsanto? And 2, they go after the intelligentsia. That's anybody that's smart enough to know what the hell they're doing. And 3, they go after the law enforcement and soldiers that are still loyal to the old regime. In our case, I guess it would be any of us that feel like I do, that there was no expiration date on that oath that we took to defend the Constitution. And I think I've just added one more class of people to that after talking with some of the people that I've been interviewing, and that's the health professionals. It's like they are targeting the health professionals, and they've already targeted the doctors. I mean, they've turned the doctors into nothing but legalized drug dealers. I mean, my mother and grandmother were strung out on pharmaceuticals, probably with about a 4,000% markup. You know, my grandmother, I thought she was just old and feeble until I took one of her sleeping pills. And my mother was on pain medication her whole life. So, this whole healthcare bill that they're trying to put out again, it strikes me as they're aiming at the nurses and the doctors that are actually oh, here, you better take this vaccine. Just go ahead and take it. That'll reassure your patients, and they might be the first to go.
Well, and it's interesting too, because with this, as you know, there's been controversy over vaccines, well, throughout the whole history of vaccines, but it reached a level that I don't think, at least in this country, that it's ever reached before during the swine flu pandemic. But I saw, here and around the world, I saw polls showing that the majority of healthcare professionals were saying no thank you. And those are the folks that I would have expected to be the first ones to be getting on board with the program and really recommending it. Now, of course, there were many medical professionals who did exactly that, but there was, I think, an unprecedented number here in the U.S. and around the world who were saying, whoa, I don't think I want to take this swine flu vaccine. Even people who had no prior concerns about routine immunizations were saying, what's the deal with this swine flu thing? So this has created an opening, in a sense, I think, perhaps ultimately into the larger immunization question. But a lot of people who maybe were on board with routine immunizations took pause and said, what's going on with the swine flu situation? And there's a lot of good reasons for people to have done that and to continue doing that. Because as you probably know, the official